So I think it's best to start from the beginning. When I was in high school, I went to an open house for a local community college. And while I was there, they were presenting a fire science program. Fire science meaning the fire department. So while I was still in high school, I started attending college for firefighting courses. Eventually, I ended up graduating with 3 firefighting degrees and continued my pursuit to work for the fire department and become a firefighter, which at the time I thought was my dream job. Immediately after graduating the firefighting academy in late 2003, I became a volunteer firefighter in early 2004. And as a volunteer firefighter, although our call volume was low, that's when I started to experience symptoms almost immediately after starting my firefighting service career. I remember the day vividly. I was at the firehouse. I was actually on shift, and I was, doing some chores around the firehouse when I started to get this pain behind my right eye. I didn't really know what it was, but I stayed at the firehouse for a little bit, and while I was there, the pain just continued to rise and get worse. So much to the point that I actually had to leave work and go home to basically take a medication and go to sleep to relieve the pain that I was feeling. So after a few months that had gone by, I had gotten this pain in my right eye a few different times, and that's when I decided to go see a specialist. And so I went and saw a ear, nose, and throat doctor, and that's when they told me that I needed to have surgery. After some time frame of dealing with the symptoms of, sinus headaches, sinus infections, and sinus pressure, and I really didn't know what it was, so that's why I decided to take the medical approach and have surgery. During that first surgery, I essentially had 3 surgeries in one sitting. So the first thing they did was remove my turbinates, which is part of the structure of your nasal cavity. And then they fixed my deviated septum as well. And then they also cleaned everything out in my sinus cavities, which is what I call the roto-rooter. So I had those 3 surgeries at one time. And after taking time off work, I returned to work about after a week. And while I was driving to work, I got called in for a fire to come help investigate a fire that had happened the night before. So literally, I just had surgery in my sinuses, and I respond directly to scene and start investigating this fire. And for the next 14 hours, I investigated this fire, and I did it without any SCBA. And if you don't know what an SCBA is, that is the fire respirator that firefighters wear when they're actively fighting a fire, or just a basic particulate mask. So I did that without any of those, breathing all the fumes and everything that off gases in a fire after it happens, along with the debris that's floating around. Even after my first surgery, I had some small relief, and I obviously could breathe better and everything like that. And but it was not too long after that I started to experience the same symptoms that I had before. The sinus headaches came back. The either being completely stuffed up or having a ridiculously running nose seemed to be the norm. I also started to notice that my taste and my smell was desensitized, and that started to progressively get worse as time drew on. So instead of trying to figure out what was causing this, I again elected to have my second sinus surgery with a different ear, nose, and throat specialist, because after I'd returned to the first one and let him know that what we had done prior in that first surgery wasn't really helping me in the long run. It was starting to come back. I was starting to get sinus headaches and pressure again, things that were definitely starting to affect my daily life. it's a problem when you can't go to work because, you have these issues and you never know when they're going to come about. So I went and saw a different specialist because the first one just wanted to give me a steroid shot. He wasn't trying to push second surgery right away, but he wanted me to take daily medication as far as, nose sprays. He wanted to give me a steroid shot that would only last about 3 months, and I'd have to do that a couple times throughout the year. And so I just sought a different opinion. And this next ENT doctor, he did want to do surgery because the CT scan did show that I did have a buildup of gunk in my cavities. And so I again elected to have my second sinus surgery where they cleaned out my sinus cavities, hoping that that would be the last time that I'd have to do that. After my second surgery, which was in 2010, there was really no plan, even with the second specialist, or an idea of what was causing these issues, what was causing my sinus infections to happen, what was causing the pressure behind my eyes to give me these debilitating headaches. And so that's when I really started actively searching for other ways to figure out, what the hell is going on. Because that's what I really wanted to know was what's causing this. There's got to be something causing this. I wasn't born, having to have 2 or 3 sinus infections a month. And so that's some of the other symptoms that I was experiencing was, at least 2 or 3 times a month I was getting a sinus infection that would just take me out, and it didn't matter where I was at, what we were doing. I would have to just basically take a medication and go to bed. A medication strong enough that would, take my pain away to allow me to fall asleep because these were so excruciatingly painful. And so, my wife and I at the time, she's a doctor, and obviously, and she was looking at studies and things like this, and really we were on the hunt. We're on the hunt for what's causing this and what can we do besides having another surgery to correct this issue. And so, she's reading studies, I'm reading blogs, I'm trying all different sorts of homeopathic remedies, none to really that affected, the overall outcome of, getting rid of this. And so I guarantee you I've basically tried everything in the book to get rid of sinus infections and sinus headaches. So after a few years of, kind of searching and trying to figure out what was going on, everything continued to get worse. I wasn't clinically diagnosed with depression, but I feel that I was very depressed because this was starting to impact my daily life. I was not smelling, which means I was barely or not tasting food at all. And I seemed to always have a, stuffy nose. It was hard to sleep. So all of these things started to really play a big impact in my life. And not only that, it's really hard to plan something, with your wife or with your family or your friends and have to call it off all the time because, this comes about and there's nothing you can do other than take a medication, fall asleep, and hope that it goes away the next day. So that was very frustrating, not only for me, but for my wife and my family and friends as well. So my last sinus surgery was in 2014. And again, they did the same thing. They cleaned out the sinuses so that, hopefully, I wouldn't have these headaches anymore. And so basically from 2014 to 2016 or 17, I really had no sense of smell. And so that was really difficult to deal with. And, that's when my wife and I, she had been in practice as a doctor for a few years. We were still actively searching for everything to try and fix this issue. And so that's when we made a pretty big shift in our diet. I like to say we were keto before keto was popular or cool. And I did actually start noticing some relief following a ketogenic diet. my sense of smell started to slowly come back, but it was still hit or miss. And I was still having the at least 2 times a month, sinus pressure headache to where I had to take a medication. So that was frustrating as well. So that was continuing to still go on. And then I believe it was in late 2016, we were promoting a supplement that we sold in our chiropractic office, and we met a couple that had told us about this place called the Wellness Way. And at that time we weren't really interested, but we ended up talking to Dr. Patrick Flynn. And for me, being in the fire service, and now I was a full-blown arson investigator as my primary role, so I kind of went through the ranks and changed departments in my career a little bit, and went from being a firefighter to a fire investigator and fire inspector. So during that time, when you're a fire investigator, your training is to be super skeptical. You follow the scientific method to determine the cause of the fire, and you have all these things in place that kind of make you skeptical even of a basic kitchen fire. You have to look at it in a sense of, could this be arson? Did somebody intentionally mean to cause this fire? So I was already a skeptical person naturally, but my career had made me even more skeptical. So when I first talked to Patrick on the phone, I was skeptical of what this Wellness Way was. And at that time in our life with my wife and myself, our son was just a few months old. We weren't really ready to, start over in our wellness business. And my wife at the time was the only one working in the wellness business while I was still at the fire department. So I was pretty skeptical. The Wellness Way has impacted my life greatly. There's no question about it. One thing I didn't mention was in 2015, I lost a close friend of mine that had come up in the fire service with me. We lost him to ultimately cancer, and he was 36 years old when he passed, and his name was Craig Milanen, and he was considered a line of duty death from the fire department standpoint because he got this cancer while working as a firefighter. And in most states they have something that's called the presumptive cancer law for firefighters. They know that firefighters, based on what they're exposed to, are more likely to get all sorts of different types of cancers than the average person. And so when he passed, that was considered a line of duty death. And that was in 2015. A month later, my first son was born, and that's when I really started to think differently of, maybe this isn't the career for me. I've struggled with these health issues. Now I've lost a very close friend of mine. My first son was born. I'm not seeing him as much. And that's kind of where the shift happened for me of, okay, I need to start looking for a way to get out. Fast forward to 2017, May 1st, 2017, I handed in my letter of resignation to my division chief, stating that I was leaving the fire department for good. And despite everybody around me, close colleagues and everything, or everybody telling me that I was making the biggest mistake of my career, I disagreed. I had to leave. I had to leave for my health. I had to leave for my family. I had to leave for my sanity. The fire department at that time wasn't a place that fostered growth or, propelled you to be the best you could be. It was just a place of discontent and stress. And it no longer grew me, and I just fell out of love with it. So I knew I had to leave. So in 2017, I left for good. And just a few months after I left the fire department is when my wife, Dr. Jacqueline, and I decided to start our Wellness Way office. And the rest is kind of history from there. Basically, when we started our Wellness Way office, we dove right in head first, and I started getting testing done on my body. because at this time I'm still struggling to smell. It still comes and goes, comes in waves, and I'm still having the monthly sinus infections that are occurring and causing me, this pain and, side effects basically from the medications. So I started to get tested my food allergies, did a stool test, and continued to start following the Wellness Way approach. And that's where, after I relieved kind of the stress of the fire department, that I actually started to feel better and my smell started to come back and I started to get my life back. And that's I can't overstate it enough on what a big impact that's been for me and my family. And, again, my last sinus surgery was in 2014. And now I'm to the point in my life where I can smell the wonderful food that we cook all the time and everything that comes with that. I can taste it. I'm no longer depressed. And, not only do I get to experience the benefit of the health benefits of, essentially getting my life back, I get to work alongside my wife every day and help other people experience something similar to what I've experienced in my health journey. And that's something that's very, very powerful. And I absolutely love it. I'm coming up on my 3-year anniversary on when I left the fire department. I haven't looked back. I don't miss it. I don't miss the stress. And this is just wonderful. Again, I'll mention, I kind of call myself that I'm the ultimate skeptic. And, if somebody watches this and they're skeptical of our approach, or if you think we're going to sell you snake oil, I can tell you that you're 100% wrong. And that you just need to get to a Wellness Way office, go to an inflammation talk, and you know what? The best thing you can do if you are skeptical is do your research, do your own investigation, kind of like I would as an arson investigator. And you're going to find that we see people come into our office every day. Wellness Ways across the nation are treating people every day for all kinds of things and helping people on their health journey to get better. And I think that's the only thing you're going to find. So you can try and figure out, if this is real or not, but I guarantee that it is, and it's going to help you in your health journey. I know from this point, my health journey is still ongoing after being in the fire department for 14 years. And I know my future looks bright. And I now have something that I can look forward to. My smell continues to be better, and I can taste my food. I can smell the great food that we cook all the time in our house. And my journey's not over, but I know that following this approach and thinking differently about how we approach treating or healing the body is great. And not only do I get to do that for myself as part of my health journey, I get to do it alongside of my wife, who's the doctor in our office. And I get to talk to patients every day who they may be in a certain stage that I've been in. And I get to help them along that way, just being in the office with them and sharing my journey and, guiding them with the approach to think differently. And that is powerful. I'm Paul, and I am the Wellness Way.